So here's an objection. They're going to say, so why don't you partner with insurance? And this is what we're going to say. We don't partner with insurance companies because they dictate what we do for you and what we can't by only covering certain techniques, not by what is best for you. Also, reimbursement is so low that we would actually have to see 3 to 4 patients for 1 hour in that same hour. And we don't want to do that because we know we need time with you to fully understand your body and truly have a multifaceted approach and provide the quality cares to get you back to your goals the fastest that we possibly can get you there. So this is why we don't partner with insurance. Okay, that's one way you can handle that objection. Okay, another way is this. Okay, so why don't you partner with insurance companies? Totally understand the whole insurance thing. The majority of our patients have insurance and they decide to come here because of a few things that we've actually figured out. Let me ask you this. How long has this problem been going on for? Patient, more than likely, for pelvic health, is going to say like 3 years. Have you seen anyone for this, or is this the first time you've seen a provider for this issue? Yeah, I saw people before, and I don't know if it's going to work. That's why I'm really, cautious on coming in because I've seen so many providers and it really hasn't worked. And then you ask, so have these providers that you've seen been through insurance? Yes, they've been through insurance. Can you tell me a little bit more about these providers and how long were you seeing them? How much do you think you have paid so far working with these providers? I have seen so many specialists throughout the year. I have no clue. Maybe like at least 2-3K. I can tell you that the people that are here at our clinic, the reason why they stay here is because once they finish with their plan of care, their problem never comes back to the way it was. And because of that, it's not only saving you so much money on the back end, but it's also saving you so much time. And we all know how important time is. And, if we can save it, we love to save time. One of the things I think is important to understand is that you've been dealing with this for 3 years and maybe you spent like 2, 3, 4K in investment in copays. How many times did you have to take off work as well or, leave your kids at home or get a babysitter for your kids to be able to go to these appointments? That's a lot of time. And these people don't have a proven method. We have a proven method called the LSR method, and we've used it on thousands of people like you. And we know that we can truly help solve this problem based on our method and the results that we have gotten from it. So, and then this one, look, if we can't help solve your problem, I would refer you to someone else. But this problem you have, we have the proven method to help solve this problem. If we finally get this leakage and problem solved, then what does that look like for you? Like, what would that do for you? Can you tell me? Well, I can go to the gym now and not be embarrassed because I have leakage, the person's going to say. I know this is why you're here. So are you ready? Are you ready to do this? So this is conversations that you can have with patients that truly have an objection about insurance or about money. Try to break it down for them that in the past, they have spent literally thousands of dollars on copays for in-network, and people don't realize, they think, in-network, it's going to be free to me. No, that's not the case. They have to pay a fair amount out of pocket, especially if they have a deductible. They're paying thousands of dollars anyways. So trying to get them to understand that it doesn't truly matter if it's out of network or in network. They're still going to be paying some kind of money. And who's going to solve the problem the fastest and not take up as much time? We are. We are actually going to solve their problem the fastest and not have to cost them as much because they're not going to physical therapy 2 to 3 times a week. They're only going once. So we're actually saving them time and money because they're doing less of both. So that's what we got to get them to understand over the phone.